to see some parts of Streptococcus are remaining. We have talked about all the toxins, etc. Now, most respiratory tract infection like pharyngitis, etc., that is sore throat, scarlet fever, that is rashes, etc. in children, it is seen. Impetigo. Impetigo is like these scabs are formed here in face, in whole body. Okay, but bullous impetigo is caused by Staphylococcus aureus. Bullous impetigo is caused by Staphylococcus aureus. I will show you the image. This is bullous impetigo. Okay, this is bullous impetigo. But normal impetigo, you can see these types of scabs. Okay. Now, and three different skin soft tissue infection, that is cellulitis, erysipelas, necrotizing fasciitis, that is caused by mostly Streptococcus pyogenes, and parpural sepsis, that is after pregnancy, in the parpurum period, the anaerobic Streptococci can cause this. Okay, this is necrotizing fasciitis. Okay, so I will show you the layers of according to layers. Up to this epidermis, that is impetigo. Up to epidermis, that is impetigo. Then if the hair follicles are involved, that is folliculitis. That is different. That is caused by Staphylococcus, not usually by Streptococcus. Erysipelas is dermis infection up to subcutaneous tissue, that is erysipelas. Now this if the infection reaches to the whole subcutaneous tissue up to the fascia, then that is necrotizing fasciitis. Up to then it penetrates the subcutaneous fat, etc., all, and reaches the fascia, muscles, etc., then that is necrotizing fasciitis. Before that, over that, that is cellulitis. Okay. So this is oil paint appearance of Staphylococcus in nutrient agar. This is hemolysis. This is hemolysis. You can see the faint color, this is normal area where Streptococcus is not present, but this is the area where Streptococcus is present. Okay, this red has been the red RBCs are been lysed by your hemolysin, beta hemolysin. Okay, this is beta hemolysis, Streptococcus pyogenes. This is cluster bacterium cocci, gram-positive cocci arranged in cluster, that is Staphylococcus, gram-positive cocci arranged in chain, that is Streptococcus. This is bullous impetigo with Staphylococcus, where you are seeing cellulitis, and if it is involving deeper, that is sorry, if it is involving superficial tissues, that is erysipelas, and if it is involving in there's quite deeper tissues, then it is cellulitis. Okay, this is erysipelas, this is cellulitis for deeper, necrotizing fasciitis is up to muscle. Now this is SJS up to skin body surface area involvement less than 10% if the exfoliation occurs, that is Stevens-Johnson syndrome, usually caused by valproate, etc., and Stevens-Johnson syndrome is also caused by lamotrigine. Stevens-Johnson syndrome 10 and 10, that is toxic epidermal necrolysis, that occurs if body surface area exfoliation occurs more than 30%. Okay, this is the image of 10, where more than 30% of body surface area has been involved. Okay, now this is the important picture. This is the important picture where we will see the classification of Streptococcus. Okay, Streptococcus are gram-positive cocci in chains. These are catalase negative. We know this. Okay, now if they are put into blood agar, they will show hemolysis. Alpha hemolysis, that is partial hemolysis. Okay, beta hemolysis is complete hemolysis, and gamma hemolysis is no hemolysis. Okay, so what is gamma hemolysis? Hemolysin toxin in Staphylococcus, that is Penton Valentine toxin. So what does it cause? It is pathogenic for MRSA. Now we are interested in beta hemolysis first. So beta hemolysis is caused by beta hemolysin. Now Streptococcus are classified. Streptococcus are classified into that is called, there is a mnemonic that is called Manic Griffith and Careless Lanfield. Okay, Careless Lanfield means C for L. Okay, Careless Lanfield, that is Lanfield classification due to C carbohydrate antigen of cell wall middle layer. So according to that Streptococcus, beta hemolytic Streptococcus are divided into various groups. Okay, various groups and there is various groups A, B, C, D, F, G, H, etc. Okay, IJ, most probably IJ is omitted. And then according to bacitracin sensitivity, if it is bacitracin sensitive, then it is group A beta hemolytic streptococcus, that is Streptococcus pyogenes. And if it is not bacitracin sensitive, then it is called your group B streptococcus, that is Streptococcus agalacti. Now this Streptococcus agalacti gives camp reaction. Okay, Christie, Austin, something Munch Peterson. Okay, reaction. Now alpha hemolytic streptococcus are divided by optochin sensitivity. By optochin sensitivity, if it is optochin sensitive, then it is Streptococcus pneumoniae. Now Streptococcus pneumoniae, you know that it is called pneumococci. It is a lanceolate shaped streptococci, so which causes upper respiratory tract infection very much. Okay, so this is Streptococcus pneumoniae. So Streptococcus pneumoniae is optochin sensitive, it is bile soluble, and it is inulin fermenter. Okay, it is bile soluble and it is inulin fermenter. Okay, now if polyvalent antipolysaccharide serum is given, which is against cell wall, which is against capsule antigen, because Streptococcus pneumoniae has capsule around cell wall, so yeah, anti-capsule agent is given, so that causes your Quell-Lang reaction, because it is quite like and methylene blue is given, it is quite like swelled. Okay, you can see there is a transparent area, so it is called Quell-Lang reaction. And Rotsman colony is called Karankoen's appearance. It is it is called it is the colony of Pneumococcus is called Rotsman colony, that is caused by autolysin. Okay, now if they are not optochin sensitive, then they are called viridian streptococci. Viridian streptococci are have no capsule, and they are usually they are the cause of they are part of normal mouth flora, and then they cause your endocarditis. Okay, so that is Streptococcus mutans, Streptococcus mutis. Streptococcus mutans is important because it creates some kind of acid. Now, if this group A beta hemolytic streptococcus is divided into various quite 80 subgroups, that is due to M protein antigen of cell wall that is present in outer cell wall. Okay, that is called Griffith classification. So I have told you the mnemonic, that is careless Lansfield and manic Griffith. Okay, manic Griffith, careless Lansfield and manic Griffith. Now now we come to the gamma hemolysis. Okay, gamma hemolysis. In case of gamma hemolysis, if we see gamma hemolysis, no hemolysis is occurring, and they are bile resistant. They are bile resistant. While your Streptococcus pneumoniae were bile soluble. They were bile soluble. Now these are bile resistant. So that means they grows in 40% bile, and they are bile esculin positive also. This is different from bile resistance. In this test they can hydrolyze esculin. Okay, now according to growth in 6.5% NaCl, it is divided into two groups. That is those who can grow, they are called enterococci, and those who can't grow, they are Streptococcus bovis, etc. Okay, they are not much importance. Now PYR test, pyrazolidine test is positive in case of enterococci, that is Streptococcus fecum, Streptococcus fecalis, which are also called Enterococcus fecalis and Enterococcus fecum. These are important for water contamination test. Okay, Enterococcus fecalis, now you have mnemonic here, L for L. In ampicillin, L also is present, so in case of Enterococcus fecalis, drug of choice is your ampicillin. Okay, ampicillin is drug of choice. But in case of Enterococcus fecum, there is no L, so in this antibiotic there will be no L also, so vancomycin is the drug of choice here. In case of Enterococcus fecalis, there is L present, so in the antibiotic also L will be present, so that is ampicillin. You have to choose between ampicillin and vancomycin, so ampicillin here for fecalis, and for fecum there is no L, so vancomycin, not ampicillin. And also important data is important information is enterococci causes most commonly In case of endocarditis, infective endocarditis, most common agent is Staphylococcus aureus. But if it is of left heart, the question is asked about left heart cause, then left heart endocarditis caused, then that is enterococci. Okay, enterococci, most common cause. Now we will see some picture. These are the lanceolate strepet cocci. These are Streptococcus pneumoniae. These white caps around these these diplococci is called these are the bacterial capsules. Okay, and these capsules can stain by Quillang reaction. The capsule swells up and methylene they stain in methylene blue. Okay, this is Hemophilus influenza. You can see in these cases bacteria are blue, so these are your gram positive, that is Streptococcus, but these are red, so they are gram they are gram negative, so they are different. This is Staphylococcus aureus, bacteria present in cluster. These are other things. Okay. Now one thing we will discuss two diseases according to we discuss few diseases also, clinical cases. Now we'll discuss about infective endocarditis. So infective endocarditis is the infection of the endocardium layer of heart. Okay, so what happens, your valves etc are affected, so there will be new onset murmur, heart failure, etc, heart block. Okay, such things. So there is a criteria called modified Duke's criteria. Okay, that is Duke's criteria. And most common cause for infective endocarditis overall, I have said Staphylococcus aureus. And community acquired, if it is natural community acquired, native valve endocarditis. Community acquired, if in simple terms, if it is community acquired, then it is Streptococcus viridans. Means if it is acquired in normal environment, and if it is acquired in a healthcare environment, then the most common cause is Staphylococcus aureus. But overall, most common cause is Staphylococcus aureus. Prosthetic valve endocarditis, these causes are asked. If less than 2 months, then it is cons, and that means epidermidis etc. Usually epidermidis. 2 to 12 months, then again it is coagulase negative, and if it is more than 1 year, then Streptococcus viridans. So viridans Streptococci, normal mouth flora, we know that. In case of IV drug users, most common. So we now will discuss about 2 to 3 diseases that are very much important. That is, first one is infective endocarditis. So infective endocarditis is a infection of endocardium layer of heart. So in the innermost layer. So what happens is the valves etc are infected, valves etc. And usually the cause of the infection is your Staphylococcus aureus. Okay. Now, what are the symptoms of infective endocarditis? There is called a modified Duke criteria, by which infective endocarditis symptoms are diagnosed. Okay, infective endocarditis is clinically diagnosed. So that is new onset heart failure, new onset cardiac murmur, heart failure, new onset heart block etc. Such things happen. Okay. So most common cause is Staphylococcus aureus. I have said this. Most common cause of community acquired infection is Streptococcus viridans. Most common cause of healthcare associated with endocarditis is Staphylococcus aureus. Now, in case of prosthetic valve endocarditis, if less than 2 months, so you have to remember it like this, then it will be easy. If less than 1 year of prosthetic valve implantation, then it is coagulase negative Staphylococcus Staphylococcus epidermidis etc. And if more than 12 months, that means 1 year, that is Streptococcus viridans. Okay. Now, in case of IV drug users, most common cause is Staphylococcus aureus more than Enterococci. In case of IV drug users. Okay, so enterococci are gamma hemolytic. Okay, so if the question specifically says that left heart endocarditis is present, like mitral valve and etc are involved, and both the options enterococci and staphylococcus is given, then that is the most common cause for left heart endocarditis is enterococci, and for right heart endocarditis the most common cause is staphylococcus aureus. So if some cases are culture negative, in some cases of infective endocarditis the culture comes negative, and the most common cause I felt that it should be added here, has a group of organisms more than Tropheryma whipplei. Okay. Now we'll go to rheumatic fever. Very short discussion about rheumatic fever. Rheumatic fever is an autoimmune disease, and it occurs because the cell wall protein of the cell wall M protein of the Streptococcus, group A beta hemolytic Streptococcus, after a URTI, after a upper respiratory tract infection, it mimics the myocardium your myocardium phospholipids. So that's why antibodies are generated, which also attacks your myocardium. Okay, that's why rheumatic fever occurs. And in case of acute rheumatic fever, if the ASO titer, that means anti-streptolysin O titer, if it is more than 333 TODS unit, it is called TODS unit. Then for children, then it can be highly sensitive, sensitive, and if it is more than 250, then it is, for adults it is quite diagnostic. Okay, it is a primary criteria. In case of acute rheumatic fever, not rheumatic heart disease. Okay, so you can remember this, children. C is the third letter of the letters among the letters A, B, C, third letter, and so here 333. Okay, that's the mnemonic. And there are some pneumococcal vaccines also. Pneumococcal vaccines are given in a very vulnerable group of patients, like splenectomy patients, because there is no spleen, so splenic macrophages will not work. They can't capture those capsulated organisms. So pneumococcus is a capsulated organism. So for that, pneumococcal vaccine is given. So there are two types of vaccine: PPV23, that is pneumococcal polysaccharide vaccine, and there is a protein conjugate vaccine that is given in children less than 3 years, etc. In which cases the PPV23 polysaccharide polyvalent vaccine is contraindicated. In such cases, protein conjugate vaccine is given. Now we will see last diagram, that is of Micrococcus. I told you Micrococcus is a commensal of a body, but sometimes it can cause infection if the patient is immunodeficient, like in HIV. Okay, there is a typical question in MCQ that tetrad arrangement is given in picture, so you have to identify so that is, if this tetrad arrangement you can see, then this is tetrad arrangement, that means 4 cocci at a place. If you can spot them, then that is Micrococcus. Okay, so thanks for the day. From my behalf, I am Dr. Kulhan Das, and I think we will bring more such videos about more such microbiology, about more such bacterium, and we will continue this RRR NEET PG revision series. So thank you for hearing us.